Good afternoon, everyone. All right. I think the first thing I want to say is, as honored as I am to be up here on this panel, I think many of us would have loved to just have Joan continue to field questions from the audience because she is such a wealth of information, and I know that we all could have benefited from even more time just hearing your thoughts as we try and address our own issues around diversity and leadership and hearing from your experiences. With that, I'm honored to be here on this panel and try and talk about leadership and where I am in this continuum of leadership, young versus old leadership, established leadership, I guess I should say, and realizing that I don't necessarily consider myself a leader, and when I started doing the work that I do, I considered doing the right thing, and that has propelled me into a position where I'm up giving talks and giving presentations. And so I guess I am a leader because I'm doing the work that I think I'm most passionate about. And so I want to keep this brief, but there's really 5 things that really sort of come to mind when you think about leadership and developing your own path. And first is, what is your niche? What is your area of interest? And as you develop that area of interest, how do you become an expert in it? And becoming an expert, when you develop that level of expertise, you need to try and work around with the system that you're in to get buy-in for your area of interest. And once you get the buy-in, you need to learn or consider pushing the boundaries and making people a little bit more uncomfortable to continue to move the agenda forward. And I think most importantly in all of this is making sure you have an established network to help support you when the buy-in isn't there or the boundaries that you're trying to push are pushing back on you. So just thinking about my journey and where I'm at and thinking about the niche that I've tried to carve out for myself, as an emergency physician, when I came into residency, it was immediately pushed upon me that I needed to figure out what type of emergency physician I was going to be, whether I was going to develop an area of expertise in toxicology or ultrasound, whether I was going to be concerned about issues around stroke or diabetes or other conditions that commonly present to the emergency department. And what I realized is, although I love practicing clinically, there's more to what I want to do outside of clinical medicine. And so I realized that my area of interest wasn't necessarily in what you traditionally think of as what you think of when you think about advancement in medicine. I was thinking more about how can we diversify the healthcare workforce? How can we promote change so that all patients receive the same quality of care? How do we eliminate those health disparities? How do we make sure that equitable care is given to all of our patients? And that was my area of interest, and that was my niche. And what I realized is there wasn't too many people in the area in my department that were even considering this as part of their practice because they thought we all did it anyways, and this isn't something that we needed to focus on. And also, it wasn't something that was going to lead to career advancement, something that Dr. Reed had mentioned in her slides. And I realized that I needed to push the boundaries because this is something that I felt most passionate about, and I realized that I wasn't going to be happy as a professional if this is the path that I took for my career, and I needed to make sure that I addressed my true concerns and how I would think that I could do the best for my community. And what I did was I tried to become as much of an expert as possible on these issues. And I will readily admit that I am not an expert and I can't quote data like Mark Neve, or I don't have the same experiences as Cedric Bright. But I do know what my areas of interest are, and I do know that I'm going to continue to learn and push my own self to making sure that I'm best prepared to answer those tough questions when they come to me. And as I develop that area of expertise, what I've realized is even though I may not have the fancy title that comes along with some of with years of experience, I've had individuals come to me because they were looking for advice because I knew that I was a resource that they could take advantage of to identify for more information. As I developed my area of expertise, I realized the importance of getting buy-in from the individuals around me. And really what it comes down to is thinking about my department in my hospital. So when I was a resident and moved on to junior faculty in my hospital, there really wasn't an effort in addressing diversity, inclusion, and multicultural affairs, and we didn't even have an established office. And one of the things that we did as part of our resident organization is to develop a diversity committee where we talked about the issues that we felt were most pressing to us. And as we talked about these issues, other people started to take notice. and we got buy-in from the institution. And then it eventually led to the development of an Office of Multicultural Affairs and then an Office of Diversity, and that office has continued to climb in importance and position in the hospital. And it's something that I'm very proud of, because I remember when there was nothing, and now we have an office that's starting to do the work that we need to address many of the issues that plagues our hospitals. With that, I also developed the Tour for Diversity in Medicine, which was an effort to promote careers in the health professions to underrepresented minorities. And this is something that a colleague and I came up with because it was an idea that we realized that students weren't necessarily getting the right information, or they weren't getting it in a timely manner. And how can we go about and encourage them to go after careers in the health professions? And you know, what we realized was, when we came up with the idea, we were medical students, and at that time, people didn't take us seriously because they didn't believe that we had the resources or the skills in order to pull off the task that we had created in the development of the tour. And it wasn't until we had established ourselves in our careers and started to get a little bit of a title, but also started to get more expertise in the matter, that people actually gave us the time of day. And I was very grateful to the Aetna Foundation for sponsoring our first 4 tours and helping us to reach over 1,500 students interested in careers in the health professions. You know, we got a lot of buy-in and we got a lot of support initially for a number of the projects that we did, but we also got a lot of pushback. And we also realized that the boundaries that we were coming up against weren't going anywhere. And we had to figure out ways to help push those boundaries, to overcome those boundaries, and to help remove those boundaries. And I think that when you think about what's happening in medicine, in order to push the boundaries, you need to be ahead of the curve, and you need to be aware of the changes that are going to happen. It's really important for you to be aware of changes in leadership that are going to be happening in the institution, or those other power plays that come about. And for us, as we developed a number of our projects, we were able to continue to push the boundaries. And we talked about this briefly. A couple of the speakers had mentioned, you know, how do you push the boundaries? How do you get institutional buy-in? Well, you know, when you talk about mandates that are coming down from governmental organizations or governing bodies that help determine where the funds are coming in, when you make the business case for the importance of the work that you're doing, people start to pay attention, and they don't necessarily want to hear it when you just talk about diversity and you talk about we need more blacks and Latinos in positions of leadership. But when you make the business case on how it's going to impact the bottom line, how it's going to impact the institution, how it's going to potentially bring more money into the organization, or how they may be critiqued based on not meeting those metrics, then they start to pay attention. The last comment I want to make, and I'll end, is the importance of a network. And having great mentorship is key for any of the young leaders that are out there. Being able to have someone to look up to turn to when things aren't necessarily going well, or you're trying to figure out what your next move is going to be, is important. So having mentorship is important, but then also having peer mentorship and having a collection of individuals who are around you, who are around the same age, same experiences, same academic positions. All of that is important because you come together and you grow as a unit, and you progress as a unit. And you know, my group of peer mentors, now, you know, we're instructors and assistant professors, but hopefully in 20, 30 years we'll be the full professors, and we'll be the ones, you know, sitting around the big tables in the C-suites making those big decisions. But it's really important for us to have that relationship. You know, I think you also need that support network to make sure that when things go right, you can celebrate your wins, but more importantly, when things go wrong, you have a shoulder to lean on and someone to turn to help you figure out what your next step is going to be. So again, leadership is something that needs to be cultivated. Identifying people who are potential replacements for yourself, I guess, is also something that needs to be considered. And as with the work that I do, I always think about who's coming up behind me and how can I help them along the way. And that's the last component of that network, is making sure that you are helping to train people. And even myself in my more junior position, I still look for the next individuals that I can help build up. With that, I will end my comments and turn it back over to Garth.